We are in times of crisis. We are facing uncertainty, and people are going crazy with fear and anxiety. They are not able to handle the stress of the situation. And I would say a large part of it is because of the media and both the press media and the social media. And the fear component is what is very difficult to handle. That is, it's really impossible to handle. And I get calls every day, from people worried about, these are stable people, but they're worried about what could go wrong. They read in the news that you can have sudden death, you can have sudden breathlessness. And the messages which I get every day, these are the more difficult things to handle than just managing the medical aspect of the patient. And the only way is, I think we need to step back and realize that there is no need to panic. This is a situation, we have to face it with a smile and go on boldly with it. The more you panic, the more irrational and unreasonable you tend to become.
So my second question for you is that we all know that we need to mask, wash our hands, sanitize, keep that social distance. What else can we do? How do you think, like the way you're saying that we're all panicking, what can we do to stay away from this panic? What must we do other than masking and sanitizing?
See, what is very scarce during this time of crisis is common sense. We somehow lose common sense in most situations. We realize that it doesn't make sense, but we still can't, accept. And I think the most wanted entity now is common sense. So apart from, we know that this disease is transmitted through droplets, so we need to mask. We know very well that a person who has symptoms, if he masks, the risk of transmission is much lower than the person who has infection being unmasked and everybody around being masked. But I think what we need to realize is, indoors, when there is lack of ventilation and doors are closed, even if you mask, there is a high risk of infection. So the simplest is to ensure that you are outdoors where the ventilation is better, or if you are indoors, there is no problem using an air conditioner, but make sure that the windows are open or there is some form of ventilation so that the air doesn't stagnate. So ventilation is the most important aspect, whether it is parties, whether it is eating, the more you have outdoors, the better you are. Now, apart, you have to remember the simple good food, a 7 to 8 hours sleep. I told you what your grandmother taught you, when you go out and come back home, wash your hands and legs, make sure before you sit to eat, wash your hands, have a good food. There is no specifics in food, vegetarian, non-vegetarian, as you always say, it doesn't matter what you eat as long as you have discretion and common sense in your approach. So that is all is needed. You can fall dead at any time. You don't need COVID for that. That is different. But as long as you are healthy in your lifestyle, you eat sensibly, you indulge in any vice in a sensible manner, I think that's all you need. I've seen people who are fit and healthy do far better than people who are obese and, who have other issues. With regard to, can you fall dead after COVID? Yes, COVID does increase your risk in certain ways. For example, the risk of clotting is increased in COVID. So your chances of getting heart attacks or your chances of getting clot in the blood vessels in your lung is definitely higher than what a person who doesn't have COVID will go through. But having said that, this risk is very, very small. We don't worry about driving on the road. We know that there is a risk of accident, but we take precautions and drive on the road. So similarly, as long as you are sensible, you don't push yourself into exercising after you recover from COVID. You need to give time for the body to recover. You take it easy for a few days or weeks before you go back to your original, whether it is your gym routine or your games routine. That is all is required. There is no worry that you'll fall dead. Right. The good news with COVID with regard to children is that it is very well shown that children, if at all they have disease, is much less than adults. In fact, in all the COVID literature, less than 1% of children under 10 have been involved. So the risk of passing the infection to children and the risk of children passing the infection to others is much, much lower than transmission between adults. And severe illness in children is very, very uncommon. It does happen, but it is very rare. And more than the COVID causing a problem, sometimes there is an immunological response post-COVID, which sometimes can cause severe illness in children, which may require steroids or other agents to suppress the immune response. But apart from that, I think it has been even shown that closure of schools probably may decrease the chances of pandemic spread by maximum 2 to 3%, not more than that.
Oh.
So, in fact, the risk of keeping the schools open and ensuring shift system, safe distancing, minimizing the number of students in the class, and ensuring ventilation, all will be probably enough to minimize significantly the risk through school openings. So the good news, again, I repeat, you need to worry more about the people who are older rather than children. Children do very well. Usually they may have a fever for a day and recover very well. I wouldn't worry too much over children. It is mainly the elderly we need to watch for. On lighter vein, the only thing I will request my patient or expect my patient to be is somebody who doesn't Google and come and ask me questions from Google. That's the only thing I would like. Because now in the times of WhatsApp and Google, everybody has finished university with a PhD. So,
Yes.
they come and tell you what we should do for them. We have studied medicine for 15 years and practiced. I wouldn't say, working. We are still practicing for another 30 years. But they read Google in a matter of a few hours and then come tell you what is to be done. So that is what I think we should avoid. But anyway, lighter things apart. If you ask me for an ideal patient, I would expect, I tell all my patients, we will take care of the medical aspect, don't worry. But there are two aspects which we cannot do, which I want you to do. One, I want you to eat a good diet. You're a dietitian and this is something which is very basic. So I know during times of COVID, your appetite is poor, but whatever it is, ensure that your nutrition is adequate so that your immune system responds. It has been very clearly shown that stress is an anti-immune, has an anti-immune activity. The more the stress, the greater the chance of severe infection. So you need to reduce the stress. So second thing I tell them is you need to have a positive mental attitude. The more you are positive and are able to fight the disease, the sooner you'll get better. So an ideal patient is someone who takes his food, however bad it is, and two, stays positive during these times so that he'll go home sooner. What you said is perfectly true in the sense that the infodemic or the information pandemic is killing. People mean well, but the kind of false information that goes through these WhatsApps and other media is very, very influencing and can actually do harm. So the simple one is delete your WhatsApp. But since you can't do that, you have other things to do. In that situation, I think probably the first thing is always try to ensure that the validity of the information is correct. In the sense, is it authentic? Because anybody can put anything on the WhatsApp or Google and no questions asked.
Yes.
So try to check the authenticity and please talk to your doctor. That always helps. The problem is the doctor also reads that WhatsApp and gets influenced. That is different. But you have to, nothing, as you said, nothing trumps common sense. So try to not to forward these information till you check that and make that they are true. And keep your social time less, especially with regard to watching news and watching social media with regard to COVID. If you decrease itself, your stress is halfway down.
Yeah. Oh, good. That's good advice. Delete WhatsApp. I think I'm going to consider that seriously. While we are on that, people are saying that the virus is now airborne. So is that true? And should, you also said earlier that we should be more outdoors, there should be more ventilation. But now that we are hearing news about the virus being airborne, people are actually worried about keeping their windows open or going outdoors.
Yeah, it is definitely shown that the virus can spread because it's not just the large droplets to which the virus attaches itself. So it doesn't fall and drop within 3 feet. Sometimes it attaches to very small particles that can float in the air for several hours. So in that situation, if you are indoors without great ventilation, the circulating air carrying the virus can enter and cause a problem. So that is why two things. As much outdoors as possible. If you're indoors, increase the ventilation, improve the ventilation as much as possible. If other people other than your home, your immediate families in the house, avoid that. That will minimize the chances of airborne transmission. I think there have been a lot of studies done with several agents, including hydroxychloroquine, azithromycin, doxycycline, ivermectin, plasma, ritonavir, lopinavir. None of them have stood the test of scrutiny. So there is no rationale, including taking zinc, including taking vitamin C, vitamin D. None of them have been proven to specifically benefit COVID. They may have some.
You are upsetting many experts, I must tell you.
Yes, I'm being very provocative here. it is believed that these act and improve your immunity. Yes. But with regard to COVID, I don't think any of these have shown to improve outcomes.
Yeah.
See, the only medicines which seem to help in COVID or only interventions is one, oxygen in people who are oxygen level falls below 94%. Two, steroids, again, in people whose oxygen level falls below 94%. I reiterate, steroids are not for everybody. It is only for people whose oxygen drops below 94 in room air. You don't, now I find everybody popping in steroids. We see so many complications of steroids. We see fungal infections which start through the sinus, invade the eye and the brain. We have had several young people die because of these fungal infections. So please don't pop in steroids the minute you get diagnosed to have COVID. It is only for hypoxic or people with a low oxygen level. Apart from these two, which make a dramatic difference, the oxygen and the steroids, none of the other medicines make a huge difference. There are only two other medicines which I would like to comment upon. One is remdesivir, which is an antiviral agent, which again, if given to people with a low oxygen level, preferably within 7 to 10 days, I repeat, preferably earlier during the course of the illness, it decreases the duration of illness. It doesn't do anything more than that. There is no mortality benefit. It only decreases the symptoms. And lastly, a drug called tocilizumab, which is a very expensive drug. It costs anywhere from 40 to 80,000 for a course of 1 or 2 injections. This probably decreases the chance of progression in a person who's rapidly deteriorating. So both remdesivir and tocilizumab is to be used in admitted patients with low oxygen or who are showing deterioration. Apart from these, none of the other medicines have shown real evidence in improving outcomes.
That's really good to know. No, that's good to know. And we should wait for the doctor to ask us to get these medications, right? I mean, we don't need to. If I get a positive report today, should I go around looking for these meds?
No, that's why stop Googling, stop taking the decision. Doctors have studied, worked hard to get where they are. Don't think that you can, learn things in a matter of a few days reading WhatsApp and Google. Please be patient, use your common sense and speak to the experts before you decide on the medicine.
Right. What about CT scan? At what stage should I get a CT scan? Should I bother with an RT-PCR test? It's, so is a CT scan required, and when is it required, if it's required?
I'm happy you raised the question because nowadays I find everybody coming to see me with the positive PCR test, CT scan, and a whole lot of tests, half of which make no sense either to them or to me. So please don't get paranoid in doing this. A CT scan, I feel, is limited or is beneficial only in somebody who's deteriorating. You need to assess the lung involvement in the lung. Because what happens is they do the CT on the day one, the CT is normal. Then after 5 days, the patient starts slowly deteriorating. They do another CT scan and another CT scan. And please remember, CT scans give irradiation. They are not safe to be repeated again and again. They have their own damages. So I don't ask for CT scan for anybody. If at all a chest X-ray to document things are fine. If they deteriorate, if they get hospitalized, or if they behave in a manner where there is sudden deterioration where I may suspect a blood clot in the lung, only then a CT is indicated. Similarly, there are several blood tests, including your white cell count, which may go low, your platelets, which may go low, the C-reactive protein, it may go up. But there are other tests like the D-dimer, the interleukin-6, the ferritin, the LDH. All of them have slight importance in prognosis, or if they are raised, you can say maybe the person has a severe inflammation, but more than that, it doesn't give you a hell of a lot of information. So doing them repeatedly will confuse you rather than help you. See, the RT-PCR, I tell anybody who calls me with, say, I have fever or body pain or, loose stools, and I suspect possibility of COVID, but they are very non-specific. The only thing I tell them is first isolate yourself. Now, this disease is infectious to others even 2 days before somebody presents with symptoms. So if I have a fever today, I may have been infecting my family yesterday and day before. So already the done. So the minute you realize there may be something wrong, isolate yourself. Wait for a day, see if your symptoms are persisting and your symptoms are worsening or whatever, and then get an RT-PCR done. So isolation is more important than running to diagnose. I have seen so many people with a low-grade fever, do test after test after test for 4 or 5 days and then get detected to have COVID. So isolate yourself, wait for a day, get an RT-PCR. Diagnosis of a COVID is not a death sentence because the minute they get a positive test, there is panic. People
Yes.
come rushing in with a CT scan, with a blood test and asking for admission. Only more than 80% of people don't even need to see a doctor. They get better without any issues. 20% require a doctor's input and maybe hospitalization. And only 3 to 5% become serious. So please remember this. Not everybody needs to panic. And if you require hospitalization, then the doctor may ask for further testing. So you don't go around doing all the tests before as soon as you're done.
So first of all, you're saying only 3 to 5% may require hospitalization, and in that
No,
case,
about 20% may require hospitalization and medical care. 3 to 5% may become seriously ill, requiring higher oxygen levels. The studies have shown from the Center of Disease Control in the US that in people with a mild disease, people who don't require hospitalization, who have a fever, nothing else, and their fever settles within 7 to 8 days, in 10 days' time, you can come out of isolation.
in 10 days time out of isolation, that's good.
So people who become free of fever and feel much better by 10th day, the virus cannot be cultured from the respiratory tract beyond 8 days in most people.
Okay.
But the PCR test, which may detect the dead virus, may be positive for several weeks. That's why we say never repeat a PCR once you're positive. A positive test, if it's mild, after 10 days, you remove the isolation. For people who may have a little prolonged fever, you isolate for 14 days.
Okay.
Beyond that, in community, in home isolation, you don't need to do anything. People who are seriously ill in hospital or a ventilator may require isolation for up to 20 days because in such patients, there may be a high viral load where isolation may need to be prolonged. But even in them, beyond 20 days, you don't need to repeat the test. You can remove isolation without any worries.
Nice. This is really good to know. So after 10 days, if you have no symptoms, don't need to repeat the test. You can, you can go back to living a normal, commonsensical life with all precautions in place.
Yes.
Severe cases, you're saying, again, not required beyond 20 days
No.
of isolation. That's really good to know. What are your views on steaming?
You really want to know my views on steaming?
Yeah, I really want to know. Because
I don't think steaming, there is no evidence, medical balanced evidence to say that steaming helps. But having said that, if people feel that they benefit from steaming, let them have it. I don't say don't steam, but if they ask me, should I steam? I say you don't need to steam. Steam doesn't make any difference. It just makes you feel good. And if it does, go ahead and do it. But otherwise, I have a lot of people who say every time I steam, I start coughing. I say, don't steam. Now, these people are called as long haulers. Most people will settle in 2 weeks' time, but there is a significant percentage, anywhere from 30 to 40%, who continue to have symptoms even beyond 2 weeks, sometimes 3 months, sometimes 6 months. They are called long haulers. These symptoms may be anything as trivial as a dry mouth, appetite disturbances. It could be body pains, joint pains, cough, loss of hair, breathlessness on walking, tiredness, confusion, inability to concentrate, panic attacks. All of this can go on for several months in some people. We see less of them in India than in the West, but yes, we do see symptoms, quite distressing symptoms in several people. So these symptoms have to be individually evaluated and treated symptomatically in most people. But in general, over 70-80% do very well. And I feel in India it is much, much higher. Almost 90% settle down in 2 to 3 weeks' time. When you say isolation at home, it means physical distancing. So you can stay inside. If you, assuming that we have a room to stay in, even without an attached bathroom or an attached toilet, it is perfectly fine. Stay away from all the others, physically distanced. If anybody is going to come into the room for whatever reason, make sure you are masked and the other person is also masked. There is no worry about food and other things which is being sent in or whatever, contaminating the household and the others. You can be normal as long as you wash your hands, wash your plates as you normally do. You don't need to sanitize the room entirely when you leave the room. The virus dies as long as you leave the windows open, ventilate the room for a few hours. I wouldn't go around scrubbing everything with alcohol. Sweep and mop and leave it as it is. Simple reasons is all that you need to keep yourself safe. Okay, I'm going to leave you with words of what is known as commonly as Stockdale paradox. Now, this is a situation where if you're going through a very difficult time, you need two things. One, an absolutely optimistic bent of mind to accept that things will change for the better. And two, accept the reality as it is. This is called the Stockdale paradox. So you need to accept that things are bad. Things are, quite difficult, quite traumatic. At the same time, have an unwavering optimism to tell us that this will get better. So that is the only trait which has been shown in any time of crisis to pull you through and make you feel better. So if you do that, keep yourself calm and keep telling yourself that this too shall pass. At the same time, you have to accept, you have to wear a mask, you have to accept physically distance, you have to accept the realities of what is going around. I think you will survive this without any problem.